Hi, this is Dr. Robert Antolak in Macomb County, Michigan. My office is in Shelby Township, and this is thegentlendentist.com. We do quite a bit of cosmetic dentistry here in our practice, and one thing I think that people have a little bit of a concern about is when we start talking about doing either veneers or all porcelain crowns or even an all porcelain bridge. They don't know exactly what they're going to end up like. You know, it's very important to know communication is very important so that we can communicate with our client who becomes our patient, that they know that what they want is what they're going to end up having, because when veneers are done, you don't really know until it's completely done. So what we do in our office is we have a number of different communication ways that we like to communicate with our patient and even with our laboratory. We use digital photography, for example, to show somebody what their mouth looks like before, in a way that we can enhance that. After they agree that they want to do something about that, if they want to, then we will do what's called a mock-up. I will take tooth-colored composite material, which is the same material that you use for doing fillings, and I'll actually, on their teeth themselves, will build up certain areas to show them what's possible. To get more refined in the detail of that mock-up, we'll use something like this. This is a manual that we have that will show the difference, and I'm just going to show a couple differences between some things here. So this is and everything is subjective depending on what our patient would like for themselves. But these teeth show two different sets of porcelain veneers. These on the edges are pretty much flat across. You can see that, like that. That's more of an aggressive look. This is more of a refined, little softer look where the edges of these veneers are kind of softened and rounded off. But people don't really know what they want until they can kind of see the possibilities. So by using these mock-ups that we call, or almost like a prototype, once we get what they look like, the shape of the teeth, whether they want them squared off or rounded or longer or shorter, in, out, once they can see that in their mouth and they can feel it with their lips when they talk and make sure everything feels comfortable, at that point in time we'll actually take a photograph and take an impression so that can be duplicated in our laboratory. And then we also discuss the color. There are many different, we call shades, which is almost like a color guide that you would when you select paint with the different colors, and we'll have that patient look up and make a decision with us on what color they would like. And so there are many different possibilities. It's very important to know that you have to have really good communication before anything is even begun, because if not, there's much regret that can take place. Because once a veneer is done and made at the laboratory, many of them are done, and if something's not quite right, then you know there's disappointment with everybody, and people are not happy. We can make minor modifications once it's done on the teeth themselves, even when the veneers are done, but not something too major. Once again, it's important to have a good communication with your dentist. If you feel that you weren't really listened to at maybe your dentist you've been going to or whatever, please I want to let you know that at our office that we listen to your needs first and then deliver uncompromised care with respect and integrity. That's part of our mission statement. And so if this is the type of service you like, you have to have good communication for doing porcelain veneers, even bleaching, all porcelain crowns, to have cosmetic dentistry done. Please give us a call. Our phone number is 586-247-3500, thegentlendentist.com. Thank you.